what percent of CDC employees are vaccinated?
We're actively encouraging vaccination in all of our employees and doing a lot of education and outreach in order to get our agency fully vaccinated.
And but the percent?
I don't have that for you today.
I'm told that 75 to some north of 75% of CDC employees at headquarters are still working remotely. Is that correct?
We are following regulations through HHS and the federal government.
No, that's not my question. I apologize to be rude, but I'm asking a very straightforward question. I've been told that north of 75% of employees at CDC headquarters are working remotely. Is that correct?
Senator, I don't actually know the number off the top of my head.
When you
so
look
I'd
down
have
the hallway, are there empty desks? Are over 50% of the desks empty?
Senator, I don't have the numbers off the top of my head. What I will tell you is that we're working closely within HHS and the administration to follow the governmental rules for return to
There
the
was a
workplace.
recent GAO report that shows, and released in the last 2 weeks, that there's been no coordinated response from the federal government to get people back into work. Now, if there's any agency that, since we have teachers in Fulton County are back at work, that the caseload of COVID in Fulton County is about 88. At its peak, it was 606. If what I've been told by someone who, frankly, kind of knows, that people in laboratories are not showing up. I have no clue how laboratory workers who presumably are vaccinated wearing PPE would consider themselves eligible to stay at home. I say this because I just want to echo. We got to lead by example in the federal government. If our public health agencies don't have enough confidence in the immunization and in the PPE to go back to work fighting infectious diseases, there's going to be a lot of undermining of a willingness to further fund public health.
We absolutely have our essential labs back at work conducting their essential research towards this response. And we are following the regulations and providing technical assistance and technical support to the federal government for return to work policies.
One more thing. Angus King and I had sent a letter dated February the 25th asking about genomic surveillance. We've still not received a response. You referenced it in your earlier remarks. Both Senator King and I would appreciate a response.
We'll get back to you. Thank you very much.
Thank you. I yield.
Do you really not know the answer to the number of vaccinated individuals at CDC, or did you just not want to answer Senator Cassidy's question?
We're still actively working on collecting those data, and those data are updated in real time.
Could you provide that for the committee by Monday of next week?
We are working towards updating those data, and I would have to speak with my staff about where we are and whether those numbers are going to be available on Monday.
Dr. Walensky, I just remind you that there's an executive order in place for all federal agencies that vaccinations for federal workers be concluded by November 22nd, and it says that actual date is November 8th, which is next Monday, because disciplinary actions have to begin on November the 9th. So if the collection is still in process, how are you going to start disciplinary actions based upon the executive order?
We're actively updating those data. I just don't know exactly when they will be fully in, but certainly we will have those data by the appropriate deadlines.
Well, if CDC doesn't have to live by the rules, why should employers have to live by the mandate rules?
As I mentioned, we will actively make sure that we are complying with the rules because we want everybody else to as well.
Let me ask one last question, because I think what you've heard is a frustration by members about confusing messages that go out. It's confusion when somebody has to be vaccinated, though they've got natural immunity. It's confusing when this policy is in place for masks and then over here it's changed. And I realize this is an evolving thing. But correct me if I'm wrong. The CDC website currently says that if you have had COVID in the last 90 days and you leave the country and you come back in, you're not required to be tested before you come to the United States. The website says, we recommend that within 3 to 5 days of returning to the United States, you should have a COVID test. I'll leave on Sunday. I have double vaccination. I have a booster. Next Thursday in London, I'll be required to have a COVID test in London before I can fly back into the United States. The CDC's own website puts more value on natural immunity than they do on 2 vaccine shots and a booster shot.
Our guidance is intended, first of all, let me just say, I think our guidance is very simple when it comes to vaccination. It has nothing to do with whether you've been infected or not. We recommend everybody in this country be vaccinated with either 2 doses of a Pfizer or Moderna vaccine or a single dose of a Johnson & Johnson vaccine. It couldn't be more simple. Everyone should get vaccinated who is eligible to be vaccinated. With regard to our travel, our travel guidance and our travel restrictions are to keep Americans safe, to keep people traveling to the United States safe, and to keep our local communities safe.
Let me repeat what the guidance is. That if I leave the country and I've been infected and recovered from COVID in the last 90 days, I can come back in the country without a requirement to be COVID tested before I come in the country. Though I'm recommended once I get in the country to have a test within 3 to 5 days. If I'm vaccinated and I'm boosted, if I leave the country, I've got to physically be tested outside the United States before I can return to this country. I'm not asking a question, I'm making a point.
Senator,
that is so confusing that there's every reason to believe that the American people can look at this and say, what the hell are you guys doing? What are you judging this based on? It's not common sense, and it's certainly not science.
The scientific ground for these tests is that these PCR tests can stay positive up to 12 weeks. And so what we're working to prevent is that people who would have a persistently positive test from prior infection not be confused with people who are newly infected in that country. They actually have to prove that they've had a positive test. So we're not looking and misdiagnosing them as newly infected. Well, it's the science that's informing that policy.
Your stated policy suggests that you put more value on natural immunity. It does. It does.
It's the performance of the diagnostic tests, unfortunately.
Thank you, Madam Chairman.
Thank you.